Okay, so now we're going to do some very specific capsular work for the hip. Remember, the hip is very much like the shoulder joint, and it has those rotational or axial abilities, and that's what we're going to focus on. So before we have this big motion and our global motion, now we're going to keep it very specific, a little more detail here. So we can do this from multiple positions. I happen to be standing, but you could do this from the lying position, the sitting position, the side lying position. There are various ways that this can be performed, but for our purposes today, I'm going to use the wall as a stabilizer, and I'm going to come up into just a very simple position that we use very similar with the arm, which is just bringing my leg straight up. I'm going to try to keep this angle here, and I'm going to try to keep straight here, so I don't want my leg to deviate in other directions. Now, I like to imagine that somebody's just turning a big faucet, and my leg is that faucet. So I'm going to think this leg moving out as much as I can, and then moving in as much as I can. Outside, inside, and I'm keeping that motion focused right here at the hip joint. If I were to look straight on at you, it's just going to be a very subtle out and in. Keeping in mind we want to avoid, when I move my foot out, the knee dropping in, and when I move my foot in, my knee dropping out. So I want to keep it very straight as it rotates in the joint.